The emerging field of regenerative aesthetics and reconstruction are making possible new ways for your own body fat to help heal, restore, and improve your health and appearance. One of the pioneers of regenerative aesthetics and reconstruction, Dr. Jeffrey Hartog, practices at the Bougainvillea Clinic in Winter Park, Florida.
Over the last few years, the Bougainvillea Clinic has become a center of excellence for a whole new subspecialty within plastic surgery known as regenerative aesthetic and reconstructive surgery. The concept of regenerative aesthetic and reconstructive surgery really centers around fat grafting. This is a way of using your own living body tissue, your own fat removed with liposuction, as a way both to enhance your aesthetic appearance, but also, if necessary, for reconstructive purposes such as for breast reconstruction.
Dr. Hartog calls body fat liquid gold because of its many uses in rebuilding and even regenerating your body. Fat grafting has a long history, and recent advances have dramatically improved its success.
The science of fat grafting has evolved to such a degree that we can now predictably use it for all manner of purposes, including facial fillers, as an adjunct to facelifts, for breast reconstruction, and for breast augmentation. This is in fact a natural alternative to using implants, for example, for breast augmentation and reconstructive surgery, and in many cases can now actually replace traditional surgery.
There's more to fat than use as a filler. Dr. Hartog and other surgeons observed that the skin above fat implants often improved after a graft was done.
One of the things that plastic surgeons like myself noticed when we performed fat grafting, particularly in the face under the skin, that there could be a significant improvement in the quality and the appearance of the overlying skin, particularly when the skin had been previously damaged by problems like excessive sun damage or even radiation therapy for cancer. About 10 years ago, this actually led to the discovery that fat is much more than just a filler. Fat is in fact the richest source of your own adult stem and regenerative cells in your body. We established the LiquidGold LipoBank as the first clinic-based and FDA-registered tissue bank devoted purely to storing fat in the United States. This has allowed us to store fat removed with liposuction from our patients for future use.
The Bougainvillea Clinic has used this new approach to fat grafting to help women who need breast reconstruction or who've had problems with conventional breast implants.
Hi, I'm Michelle Hartog. I'm a registered nurse and wife of Dr. Jeffrey Hartog. I run the Bougainvillea Clinic with my husband, and in September of 2010, I was diagnosed with breast cancer. I opted for a double mastectomy, and at that point I had to think about my options for reconstruction. As a nurse, I knew a lot about implants and flap. My husband had been working on using fat for reconstructing breasts at that point, and I decided that that was the route I was going to go. It involved doing some liposuction to take some fat from abdominal area and the buttocks area, and then we transferred that into the breast area. So I was able to do this on an outpatient basis. It did not require any significant amount of downtime. You may encounter physicians who tell you that fat doesn't work, it's not a good option, and I encourage you to do your research and come and talk to a lot of other physicians that actually do this, because with the newer techniques, we have a much better predictability of the fat taking. It does work. I'm living proof that it does. Just really research your options and do what's best for you.
My name is Kimberly Hayes, and I'm a client here at the Bougainvillea Clinic. 2 years ago, in August of 2010, I was diagnosed with inflammatory breast cancer. That type of breast cancer is one that invades your skin. So when I went through chemotherapy and then double mastectomy, they did not leave any extra skin. So because of that, I wasn't really a candidate for the immediate reconstruction, which I always assumed I would get. Then I met Dr. Hartog and Michelle, and she told me about Brava. This is something that happens on the outside of your skins. You wear these domes, stretchers, daily for 3 or 4 weeks. It basically creates a pocket. Dr. Hartog goes and performs liposuction on you, and then you have your thin body again, and he takes the fat from your body and places it into the pockets that he creates with the Brava domes. When you put your fat, the non-radiated fat, into your radiated tissue, it actually heals it. I have more sensation and less pain now than I did when I came in. But the part that has been the hardest for me is the aftermath. Usually you've gained weight, your hair is growing back and it's completely different than it was, and you had breasts and now you don't. So even though my process is not complete, just having some fat in my chest area makes wearing regular clothes so much easier. I don't really have to think about what could I possibly wear if I'm going out to dinner, or my bathing suit. Now I just have a bathing suit that's for really flat-chested women, and I don't have to feel uncomfortable. Nobody thinks twice about it.
These women's stories were made possible by Dr. Hartog's pursuit of perfection in improving the science of fat grafting.
In the past, fat grafting was considered to be a very unpredictable procedure. And even today, practitioners who don't use perfect technique may still have problems. In order for a fat graft to be successful, very close attention has to be paid to every step of the process. In the first step, we use the gentlest possible liposuction techniques to remove the fat with a minimal amount of damage. In the second step, we use a specialized process to purify the fat. And in the third step, we use specialized instrumentation and micrografting techniques to ensure optimum placement of the fat. This concept of micrografting is probably one of the most important reasons for the transformation of fat grafting from an unpredictable procedure to a procedure that can now be performed with a high level of predictability and safety. The concept of micrografting involves taking small pieces of fat analogous to a small bunch of grapes that can then be distributed throughout the tissues. This then allows the little stems within the grapes, which are really little blood vessels, to hook up with the surrounding blood vessels of the tissues, and this allows these grapes, which are really the fat cells, to survive. With the installation of our LiquidGold LipoBank, we are now able to go one step further, where we can store additional fat for future procedures. During the cryopreservation process, the purified fat is combined with a solution designed to protect the fat from damage during the freezing process. The fat is then frozen in a two-step process. In the first stage, the fat is frozen extremely slowly to minimize damage to the fat and is taken down to a temperature of minus 90 degrees Celsius. The fat is then transferred to a nitrogen storage tank where it can be stored indefinitely at minus 192 degrees Celsius. Fat transfer is now part of almost every reconstructive and cosmetic surgery procedure that I perform. The scientific advances in fat transfer have really transformed what I do into a true regenerative aesthetics and reconstructive surgery process. I personally am very excited about the future of fat transfer. We can also look forward to the use of fat-derived stem and regenerative cells in numerous difficult medical conditions in the future.
Your own fat, your liquid gold, can be used for breast reconstruction or to achieve a younger, more vital appearance. Liquid Gold and the emerging science of regenerative aesthetics and reconstruction offer a new path to a new you.